Hello, everybody. This is Gary. Today is Tuesday, April 18th, 2023. It is 1:12 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my Coping with Schizophrenia blog entry for today. Today, I'm not doing too bad. I just did some work on my computer. I do consumer surveys for extra money. I've already did my daily 3 times a day meditation. I'm going to do some physical therapy and bicycle exercising. And I'll do some meditation later this evening. Right now, my paranoia levels are not that bad. My anxiety levels are not that bad. My depression is not that severe. My auditory hallucinations are there, but they're very low key today. Um, this week, I don't really have any appointments that I have to keep. I have an appointment next week with my primary care doctor, and next week I have an appointment with my psychotherapist. Um, the past 2, 3, 4 weeks have been kind of rough. I don't do well during the winter, and that's why I haven't been making as many videos or following my daily schedule as much as I would like to. Um, I've been feeling better over the past couple of days. I'm trying to get back into my daily schedule to keep myself busy, to keep my mind occupied with hobbies and interests and exercise and whatever. Uh, in about 3 or 4 months, I'm going to go back to see the pulmonologist, the pulmonary specialist, because I have pulmonary fibrosis in my lungs, which is scar tissue that develops in the lungs that makes it more difficult to breathe. I certainly get out of breath when I go for short walks, especially if I'm going up the stairs. Part of it's due to the fact that I'm overweight. The other part is that I have pulmonary fibrosis. What caused the pulmonary fibrosis is not really known. I did smoke cigarettes for 35 years. That may certainly be part of it. I haven't had a cigarette in 15 months or so, although I'm still using nicotine lozenges. Nicotine is a very difficult drug, for me at least, to get off of. I don't smoke cigarettes, and I'm still addicted to the nicotine. It's just very difficult to stop an addiction to nicotine, and it's a perfectly legal drug, but it's an extremely addictive one. And I don't vape, and I don't smoke, particularly because now that I have pulmonary fibrosis, I don't want to make it any worse. Um, so I don't smoke anything, whether it's pot or cigarettes or whatever it might be. Um, so I'll be seeing my psychiatrist in, I believe, June. It was the earliest I could get an appointment with him. We did change my medications a little bit. I'm allowed to take an extra 5 milligrams of Zyprexa in an emergency situation where my hallucinations and paranoia and delusions are very, very intense and hard to cope with. Normally, I take 5 milligrams of Zyprexa twice a day. Now, in emergency situations, I'm allowed to take a third Zyprexa, which dovetails nicely with the fact that I'm also allowed 0.5 milligram of Klonopin for anxiety 3 times a day, to a total of 1.5 milligrams of Klonopin. So, but I stopped seeing my peer support specialist. I don't think she was helping me in any real way. Conversations were kind of random and pointless. But I still have a psychotherapist, of course, and I still have a psychiatrist, and I will be starting in group therapy, um, in a group that will function as a tool to help people in the group cope with psychotic thinking. And of course, the word psychotic simply means that you've become detached from reality, either through visual, auditory hallucinations, or delusions, or paranoia, or whatever it might be, having thoughts and feelings that are just simply not true and simply not a part of reality. Um, and that's what the word psychosis basically means. People use the word psychotic interchangeably with psychopath, and they're not the same thing at all. A psychopath is just someone who lacks a conscience or any sense of decency or morality. Um, so there's not much else to report on right now. I'm doing okay. Like, comment, share, and subscribe.